Welcome to Face the State. I'm Ariana Bennett. Thank you for being with us. Well, it's been part of the dentist's mantra for what seems like forever. Don't forget to brush and floss. But recently, the federal government dropped flossing from its guidelines, prompting sighs of relief from probably a lot of Americans, but outrage from most dentists. So, where did the change come from, and what do all of us need to know about flossing? Dr. Jason Champagne of Champagne Family Dentistry is here now to answer all of these burning questions. Dr. Champagne, thank you so much for coming on the show.
Thanks for having me.
Okay, so to be clear, this federal government dropped the recommendation. They're not saying don't floss, they're just no longer saying do floss?
Yeah, I think the studies that led them to make this statement have not made enough impact, or there isn't enough information that says that flossing can truly decrease, dental disease.
But what was your reaction when you heard this change?
Basically, I don't know if I was as appalled as some dentists that I've spoken with on this. However, I think I was just like, I think I was more of they're not looking at all the information. And I believe that the studies themselves have some flaws in them that led them to this.
Right, so the same issue with why they decided to drop it, the studies weren't reliable, is the same issue why we can't really draw a conclusion about flossing not working, right?
Exactly.
So tell me what you see. What's the evidence that you see for flossing?
Seeing patients day in and day out for a number of years, when patients truly floss, we can tell. And patients will tell us that they floss. And actually some statistics show that 87% of patients don't floss. And that's by the amount of people that actually admit to their own dentist that they do it. So that means 13% of people say that they actually do, and we know that that number is probably a little inflated and not quite accurate as well.
Oh my goodness.
So when patients tell us that they floss, we can usually tell whether or not they're doing something to get in between their teeth.
They're not fooling you.
They're not fooling. They're not fooling. And I think the biggest issue I'm happy that this topic was raised, and that maybe it was a little inflammatory, maybe it was a little over the top as far as the statement that came out, and it caused everyone to get a little ruffled. But it's really shed some good light, and it's actually been leading to some really interesting discussions within our own profession. I'm finding that a lot of dental professionals, we've kind of opened our eyes that okay, if people are not going to be compliant, if they're not going to do what we've been preaching for all of these years, and there's some studies that show that what they've done where they've basically told people, you're going to be in a study. We're going to we're going to monitor your oral hygiene habits for X amount of days. The amount of people that actually followed through with it was dismal.
And these are people who are supposed to be doing it for scientific purposes.
They know they're in a study, and they get in all this, but they let it go. And so if we preach this and we talk to our patients day in and day out, educate them, show them, do all these things, and they're not following through, we need to open our minds up to, okay, are there some other options out there and other ways that we can get our patient to get something in between their teeth? Because the hard and fast truth is that dental disease starts in between the teeth. It's biologic, it's anatomical. If there's a reason that it happens that way, without getting into too much scientific detail on it, but we have two different types of gum tissue in our mouth. The kind of tissue that your toothbrush can reach is what we call keratinized. It has more connective tissue in it. It's firmer, and that firmness actually protects. It almost kind of has a natural protective effect in our mouth that can reduce the risk of disease. In between our teeth, we have what's termed as mucosal tissue, and so that's a lot more. It doesn't have as much keratinization in it. It's more epithelialized. It has more blood vessels in there, and it's much more susceptible to getting disease in itself. So dental disease will always start in between. So I think the big message is, we'd love it if you'd floss, but we need to open our eyes up that there are other options out there, and if that's what's going to get you to get something in between your teeth, then we're all for it.
Well, this is like a revelation to me, because I had no idea there were two different types of gum tissue, but it makes sense then why, if you're not a regular flosser and then you floss, why it's painful, it gets puffy and red, it might bleed, and that in itself might discourage people from flossing more because it's uncomfortable.
Exactly. If you're not doing it on a regular basis, inflammation starts back up very, very quickly, and so I notice it myself. If I go a few days, say I go on a trip and I forget floss or I don't do it, and I'm a dentist and I still will go days sometimes without flossing. It'll slip your mind and you go, you're busy, you're off work doing whatever. When I get back into that routine, my gums puff up and they get a little irritated for those first few days. And so I can only imagine. It's funny because we see this on cleaning visits. I could get all of my hygienists, lined up in here, and they would all give the same answer. You can tell who flossed last night for the first time in 6 months.
Oh no! I'm going to the dentist tomorrow.
So they start that night, and your gums look just all beat up.
So you have to do it daily, or can you do it every other day? I mean, what's realistic?
I mean, I'd say daily. It really is daily. But let's be real here. We know we know the aversion to the floss, and so I've changed my messaging a lot more, and it's actually caused me to have some different conversations with my hygiene department, my dental hygienist, and the other doctors in my group. That we have to look at this and go, let's talk about what we really learned and what we were preached. We know that if you can do flossing the right way, and you will do it, the right amount of time, and an up and down motion, do it every day. All of those things, wrap it around the teeth, all of those things.
No sawing motions over the gums,
exactly.
Right?
If you will do all of that, we know that it's probably the best option. But we know that people have an aversion to it. We know that some people just don't have the dexterity for it. We know that some people, they just the thought of it. Remember, they won't do it, but they will water pick, or they will use little brushes to go in between their teeth. But what we've done is we've told patients that, that's not a replacement for floss, not a replacement for floss, and I think we've almost done ourselves a disservice in the profession by being so staunch on what we know is the right thing that we've steered people away from using something that in a lot of cases may actually be just as good, because there's some studies out there because they're getting something in there.
Right, so anything is better than nothing. Maybe flossing is the best, but anything's
better than nothing. And honestly, there are some patients, and we have these conversations in our group as well, where they'll say, well, he's not flossing, and we'll go in and we'll look at it, and I'll say, well, his teeth don't actually benefit from floss. Some people have already lost some bone and some gum tissue in between their teeth, and so they have more roots exposed. Well, if you've got these bigger spaces, now you've got this big open area. Well, floss, all it does is just kind of flop around in there, and it's not really touching the tooth surfaces. A nice Christmas tree shaped, dental brush will work far better in those types of cases. When roots are exposed, they have little concavities in them, and so they change shape as they go down into the bone. And there's no way you're going to get floss to dip into a concavity. It's just when you're trying to. So a brush can spread out and do that. So
consult your dentist.
Consult your dentist, but dentists have to be more open-minded, and hygienists have to be more open-minded that some of these other aids may be just as effective, and by using those. So it's. And it's tough because this is what we've been taught, and this is. Right. But I believe that we have to do our part too, and opening up. If we're going to really see the needle move with these patients, we've got to open up that there are other options out there.
Okay, well that was just really great information. Thank you for sharing that. I want to move on real quick to just a few other dental myths that maybe could help people. So, how about toothbrushes? Are some created better than others? You want soft bristles, hard bristles, electric toothbrush?
Okay. So I think you start right off the bat. Hard bristles, bad.
Okay.
Medium bristles, bad. Get the softest bristle brush out there. You need to protect that keratinized tissue that we talked about that your brushes can reach. You need to protect that tissue. You don't want to push that, because the more you push that down, eventually you run out of keratinized tissue. And now you're into the same type of gum tissue that you have in between your teeth. And in addition to that, bone has followed, and now you're losing bone, and you're pushing. So you've heard of gum recession. Hard bristle toothbrushes can lead to that by being too aggressive.
Okay.
So with that, I'd say always soft bristle brush.
Okay.
Sorry,
we just have like a minute and a half left, so I want to get to a few other things before we run out of time. Real quick, how young do parents need to take their kids to the dentist?
The AAPD, American Academy of Pediatric Dentistry, and the American Dental Association recommends at 1 year old, or at least within 6 months of their first tooth.
Okay, early. And then brushing, even if they don't have many teeth.
Start right off the bat, and if they don't have many teeth, there's a little finger wipes called Spiffies that we recommend, and has xylitol, which is an antibacterial, anti-cariogenic sugar that actually can, you kind of ripen that on the teeth. It's a very helpful aid
Okay.
to kind of begin with.
And parents who are wondering about mouth guards for their kids starting sports this time of year, do you have a recommendation, or is any mouth guard good?
Kind of like flossing, anything's better than nothing. There are ones that fit better than others. There's a lot of brands out there with a lot of the different contact sports, Ultimate Fighting, some of these things that are out there. We see a lot more that are showing up on the market. The Boil and Bites that I had when I was a kid are much, much better now, so I can definitely give a thumbs up to those. But a custom fit from your dentist might make you more compliant to wear it too, because it just fits better and doesn't flop around.
Okay, so overall, consult your dentist about what's best for you. Flossing wise, we are unfortunately out of time, but Dr. Jason, thank you so much for coming on the show.
My pleasure. Thanks for having me.
I so appreciate it. Well, coming up on Face the State, millions of Americans are diagnosed with autism spectrum disorder, but there's very little training for first responders who may encounter them in a crisis. I'll speak with one woman working to change that here locally, right after the break.